Hi, everyone. My name is Nadia Pateguana. I am a naturopathic doctor, but also a very proud coach for the IDM program with the fastingmethod.com. And today I have the very, very special pleasure of speaking to someone who needs no introduction. You all know him very, very well, Dr. Jason Fung. Hi, Jason.
Hi.
How are you doing today?
Good. How are you?
I'm excellent. Thank you so much for this. So you and I met in 2016. I often joke that I was stalking you for a little bit, but then I had the luck and opportunity to meet you. And as life would have it, at the time you invited me to come and work with you and Megan Ramos at the IDM clinic in Scarborough in Toronto. So I've been with you guys ever since. Long story short, I've been a coach with IDM and the fasting method since 2016, and really very appreciative of that. And then at some point, I don't even remember exactly when, I think it was 2018 possibly, you suggested that we write a book together on PCOS. So that's what I wanted to talk to you about today. Our book is coming out in a week, and I have a few interesting questions for you. But anyway, you've written a lot of books. In fact, you just had a book come out this week, Life in the Fasting Lane, with Megan Ramos and Eve Meyer. And I watched you yesterday on Good Morning America talking about that book. So first and foremost, congratulations for that. How many books has it been now? Is the PCOS Plan, our book, is that your 7th book?
I think so. It might be 6 or 7. I mean, I think it covers different material, though. I mean, this is one of the things that I think is really interesting, is that my topic, which is often weight loss and fasting and type 2 diabetes, it actually is much more than that. So the diseases of sort of excessive insulin or hyperinsulinemia actually stretch across many, many different things. And one of them, which I actually don't treat a lot of, is PCOS. And that's why I wanted to write the book with you, because that is a particular passion of yours. And, it's not something that I treat, but on the other hand, because I know quite a bit about the, hyperinsulinemia, it turns out that PCOS is actually one of the diseases of hyperinsulinemia, and therefore very much amenable to dietary treatment, which is something that you figured out sort of a long time ago, and which is very obvious from when you look at it. However, not very well known. That is, people still treat it with all these, fertility drugs and all these other things. But truly, what you should do is look at what the cause is, the underlying cause of PCOS, and try to treat that. Because if you treat the underlying cause, the root cause, then everything gets better, rather than just trying to treat the symptoms of it. That is, if you're infertile, take some fertility drugs. That makes no sense. It's like, if you have PCOS, which is causing your infertility, then treat your PCOS, and then everything else resolves itself.
That's awesome. So you've answered all 3 of my questions, I think, but I'll go over them just in case we missed something. So really my first question, which I think you've already addressed, and I think that that's exactly why I wanted to speak with you today and share this with people who may be interested in our book, is you're a nephrologist. I think most people know that. And it makes sense that you would write a book like The Diabetes Code, which was your 2nd book. And I do think the PCOS Plan is the 7th. I have the list here. But so it would make sense that you would write a book on diabetes. So my question really was, why did you decide to write this book on PCOS? And I think you've really addressed that really well, because it's all about insulin. It's all about
Yeah,
insulin.
and it's not something people talk about. So if you go to medical conferences or you read books about how to treat PCOS, there's no sort of I don't recall the last time I actually heard anybody say, well, here's what causes PCOS: too much insulin. Therefore, the treatment logically is reduce the insulin. And we know sort of, they'll say, well, we know it's related to excessive weight, and obesity is clearly related to PCOS and that kind of thing. And weight loss clearly benefits, but nobody really says, well, let's really look at the underlying mechanisms of how insulin causes this condition. And when you start to look at that, it actually, the science has been there forever. I mean, the way that insulin causes I mean, if the PCOS is actually a number of syndromes, but one of the things that insulin does is that it tends to increase the number of androgens. And there's several different mechanisms for that, which we talk about in the book. And if it increases androgens, then you get this sort of hair growth, and then the other thing that it does is it causes this follicular arrest, which is where it stops the sort of production of a mature sort of egg. So that if you don't have a proper egg, then therefore you can't get pregnant. And at the same time, you have all these immature eggs that are developing, but they all get stopped at a certain point. And therefore you get this sort of backup, which is where you get all these cysts, which is the name of the disease, polycystic ovary syndrome. So it's just like if, for example, you have kids who normally graduate grade 6 and we go on to grade 7, and you say, okay, we're going to stop everybody at grade 6, and all the kids sort of pile up. That's the same thing, right? All the eggs are supposed to develop, and the mature egg comes out, and then all the other eggs sort of shrivel up. That's what happens during a normal cycle. One egg is selected, that one sort of follicle is selected, becomes the egg. Because of this follicular arrest caused by hyperinsulinemia, you get all these sort of follicles that never sort of develop into an egg, and all these follicles that never shrivel up. So then you get all these things. So it's very clear that all of the sort of symptoms of polycystic ovary syndrome, which is the hyperandrogenism, the cysts, as well as the lack of ovulatory cycles, they're all caused by insulin. So then if you think about it that way, it's very logical. If the problem is too much insulin, then you got to lower insulin. There's nothing else to it. And the key is that there's no real drug that's going to do that for you. I mean, it's a dietary thing. So, and that's great, because now you can actually do it for yourself. And this is where it's, so important to have the sort of practical experience that you have, which is that when you start to treat people with a good diet, like, intermittent fasting and ketogenic diets, both of those which are going to lower insulin, then you see the bottom line, which is that your clients who are sort of desperately trying to conceive actually are able to conceive. And that's sort of, one of the very sort of core things that makes us human. Like, as parents, you understand the sort of, how much a child brings to your life. And people who can't are like, they're so like, they're willing to do anything, pay any price to do it. And they just need the knowledge to say, hey, this is your disease. This is what you need to do to get it done. And it's not a guarantee, of course, but on the other hand, it's something that they can take that into their own hands and actually make themselves better.
Absolutely. So again, question number 2 and number 3, and I know that you've gone through that very well in a lot of detail. Our book has, for those that like the science, and this is why I'm so thankful to have written this book with you, you've highlighted this, summarized it, and actually detailed it perfectly. What's the cause of it and how to treat it. So really, the second concern, and this is part 3 of our book, and it's called How Not to Treat PCOS. And what's, in your opinion, the worst or the least helpful conventional treatment for PCOS right now? Because it is a very common condition. It is, many people have it. It is debilitating and very serious. And it is being treated conventionally. And so what, in your opinion, and what we have highlighted in the book, is the worst treatment for PCOS right now?
Well, I think that the worst is that they're all symptomatic treatments. That is, they're not looking at what the root cause is. So anytime you have a symptomatic treatment, it's not going to actually make you better. It'll make the symptoms better, but it doesn't make the condition better. Just like if you have a really bad bacterial infection, you need antibiotics to take care of the bacteria. You don't treat the fever, because that's just going to take care of the fever. It won't take care of the bacteria, so you need antibiotics for that. Same thing for almost all the current treatments for PCOS. That is, if the underlying cause is too much insulin, you got to lower insulin. Instead, they say, well, what do you want to do? And you can see this. A lot of standard textbooks will say, well, treatment of PCOS. Well, what's your goal? If your goal is that you have too much hair, then shave. And it's like, well, it's not a real treatment. That tells you nothing about why you've got too much hair. Or if you want to get pregnant, here, go do IVF and go take Clomid take this and take that. It's like, well, it's fine. It will help for whatever goal you're setting yourself, but it doesn't treat the underlying disease. And the problem is that it's not just a disease. Like if it's just a disease of too much hair, then it's not a very serious disease. But the problem is that because of the hyperinsulinemia, it winds up putting you at risk of all kinds of other diseases down the line, which is type 2 diabetes, obesity, and all this sort of stuff. So it is a condition that is very important, not because of the excess hair, for example, or the fact that you can't have a baby. That's an important thing for people's lives. But from a health standpoint, it goes much beyond that, because it's not simply the excess hair, it's that you're going to be at super high risk of the other diseases of hyperinsulinemia. So therefore, you have to treat it now. Otherwise, you could develop type 2 diabetes, you could develop heart attacks and strokes and all that sort of thing. And it's fairly well known that people with PCOS are at high risk of these other conditions. And it's not because of the symptoms of this condition of PCOS, it's because of the root cause. That's why I'm always, more than anything else with all these sort of obesity and diabetes and so on, I always like to look at what the root cause of the problem is, because if you don't get to that root cause, then you'll never be able to, make people better. At least that knowledge is at least empowering. And I think that's what's new about, it's not new, but it's not really written anywhere that I've seen for PCOS. And I thought, well, this is a great opportunity to, to really put it out there so that people can understand in a simple way, one, what the disease is, two, how it's caused, and three, how to treat it and treat it simply, because you've been doing that for many years now.
This is so important. We're smiling quite a bit and making jokes, and the only reason is because we're very grateful to have, I am at least, and I know you are, to have had the opportunity to bring such a simple solution to so many women, which you're right. I've worked with these women for 16 years. I was one of these women myself. And so it's a very serious condition, but the solution is quite practical, and we're very happy and grateful to have the opportunity to bring this forward. And as you mentioned, it's the associated concerns that make it that much more serious and debilitating. Because as we wrote in the book, Jason, and you wrote this part in great detail, yes, women with PCOS can actually have a baby through artificial insemination, IVF, and whatnot. But the biggest problem, and I highlight this immensely everywhere in the book and in my consults with people, the biggest problem is the associated conditions, particularly for these women that are getting pregnant without resolving PCOS. They have very serious pregnancy complications, postpartum complications, and these children, including my own, are at a very high risk for metabolic syndrome. So we cannot overlook this. Yes, you can get PCOS women pregnant, but it would be much better if women had the information and the knowledge that we're hoping to bring forward to very simply treat this condition before they get pregnant and maybe save thousands and thousands of dollars, right?
Yeah, it's absolutely, because if you're simply going for IVF treatments, you're not going to, like, one, you're going to spend thousands of dollars, which is fine. I mean, it's your own decision, but you're not taking care of all the other health implications of that hyperinsulinemia. It's you're sort of just glossing over the problem, and it's one thing for patients to do that, but it's a whole other thing for a sort of medical community to simply gloss over these issues and just sort of say, well, here, you want to get pregnant, go for IVF, take Clomid, take this, take that to get a baby. That gets you the baby, but doesn't look after your health. And this is why it's really so important to understand what this disease is. Because if you have this disease, or you're at risk for this disease, then you need to understand what it is that you need to do to make yourself better. Because a lot of this information is not going to be found at your doctor's office, unfortunately. A lot of them simply, in you can read almost any standard. I'm not trying to pick on doctors. You can go to any standard textbook, any of medicine, for example, and look up PCOS treatments, and none of them will talk about the real underlying problem of what's causing it. And that, I think, is a huge disconnect. It's to me, it's I'm not even sure why it's like that. It doesn't make any sense to me.
Absolutely. And that brings us to really the third and final question here that I have for you. And these questions are, of course, are based on what we've written and also what I know people are most interested in. But really the final question is in part 4 of our book is called How to Effectively Treat PCOS. And this is where I spent a lot of time writing the practical guide. Any thoughts on that or anything you want to add to that? You've said quite a bit.
Yeah, I mean, I think that the thing is to understand sort of where standard sort of treatments go off the rails. So, and then it's not simply enough to say, okay, well, this is what's wrong with this system. You have to say, well, this is what you should do. That's going to make you better. And the good thing about it is that we're not trying to promote anything that's unhealthy. Like, we're talking about natural foods, we're talking about fasting. It's not like, oh, here, take this supplement, or this my proprietary formula of vitamins or something like that. It's nothing like that. It's really just talking about trying to change your diet, because of course insulin is what affects your PCOS, and diet is what affects insulin. So therefore, changing your diet, not only the foods that you're eating, but the timing. So making sure you have a proper fasting period, because that's where, words like breakfast come in. It's the meal that breaks your fast. So you have to fast, right? So there's a time to eat and there's a time to not eat, so that your body can sort of digest. That is, there's a time for your insulin to be high and a time for your insulin to be low. And that's a normal state. If you keep your insulin high all the time, you get problems. PCOS is one of them. So therefore, fix that. And it's 100% natural. Like, there's almost nothing better. Like, we're not trying to say, oh, you should take this drug and this injection and this, other, concoction that we made up. It's just foods and diet. It's such a, empowering thing for people to be able to take that and say, okay, now I can start to apply it to my own life and then see some of the benefits.
Awesome. Thank you, Jason. I'm excited. I wish I was in Toronto, as I was supposed to have been for the book release, but maybe sometime
Yeah.
soon. Thank you so much. This was an absolute pleasure. Writing this book with you was such a great learning experience, and I very much appreciate it.
All right. Thank you so much.
Take care.
All right. Bye.